Good afternoon, and welcome to Milford Regional Medical Center's first ever virtual community conversation. My name is Laura Mann, and I proudly serve as the chair of the Board of Trustees for both the Medical Center and the Milford Regional Physician Group. I would also like to introduce the Vice Chair of the Board of Trustees who's with us today, Anthony Consigli. Anthony is a well-respected leader in our community and a valuable board member for the Medical Center. You will hear from Anthony in a short bit. Also joining us today are as panelists, our President and CEO, Ed Kelly, our Chief Medical Officer, Dr. Peter Smulowitz, and Chief Nursing Officer, Vice President for Patient Care Services, Judy Kelly. We will hear briefly from each of these panelists before we begin the highlight of today's conversation, the question and answer session. Other members of senior management are also present today to participate in providing the Medical Center's answers. In order to be sure that as many questions as possible are answered today, we ask the community to pre-submit questions. We will respond to as many questions as possible, and then as time permits, you will also be able to submit additional questions through the Q&A function. If there are any remaining questions at the end of our time, we will be sure to reach out directly to the individual who asked the question to provide the response. Now let me turn things over to Ed Kelly, Milford Regional's President and CEO. Ed?
Thank you, Laura, and welcome everyone. And thanks for sharing, for many of you, your lunchtime with us today. You know, I've been at Milford Regional for over 29 years, and I've always considered Milford to be an important part of the community, and certainly the community has been an important partner for Milford Regional. I'm excited to know that we've got over 100 participants today, and we're looking forward to speaking about COVID, because we're still leaving COVID activity, but also the future of Milford Regional and what we have on our mind. We were thrilled to get so many questions ahead of time. And so I've deferred a number of the topics I would have normally talked on, like financials and boosters and staff well-being, to the Q&A where we've gotten those questions. You know, I wanted to take just a minute to talk about what happened at Milford Regional in the system during this past January. It was our third surge and really unprecedented demand on our system. You know, it was really an issue for our entire state. It was really, even though we had so many patients, it was really a staffing issue that was unlike the first two surges, where physical plant was largely the issues there. For us, we did everything that we could to staff our place to take care of patients, including bonus pay and an all-time high of agency help that we've brought in to meet the demand. Other examples would be of changes that we made was that we, like most hospitals, canceled surgery for a number of weeks, and some of those staff were redeployed to other areas, like the intensive care unit, where we expanded from 10 beds to 12 beds. Again, a big challenge when you think about the very sick patients covering 24 hours a week, 7 days a week. And certainly urgent care was overwhelmed in terms of demand on them. And I cringed a little bit driving by every night, just seeing that the parking lots were full. Again, this was a challenge for our industry. Our academic medical centers that we would normally refer sicker patients to couldn't take some of these transfers, again, because of staffing. And for us at the hospital, we were unable to in many cases, to discharge patients timely because skilled nursing facilities in nursing homes didn't have the staff. And so what that meant was that patients stayed longer in the hospital, and patients in our emergency department was reaching an overwhelming amount. But again, I think for us, we're happy to be coming out of that surge. And today we plan to give you a COVID update, because that is still with us, and talk about our future plans. You know, as I reflect back on my 29 years at Milford Regional, I've seen a lot of changes at other community hospitals, some reducing services, and in many cases, communities losing their community hospital. And I certainly couldn't imagine that for our community, losing Milford Regional. In fact, during my time here, we've been fortunate to grow and to expand services. And really, I want to thank the community, because you've been a key part of that growth. For me, thinking about community hospitals' role, I think it's really important. First of all, we're lower cost than academic medical centers that typically take that take care of too many routine matters that could be done in the community. And certainly there's nothing like having care locally. And that's, for us, supported by a relationship with our 4 academic medical centers. So when I think about our future, I think about expanding facilities and thinking about new services and expanding in areas where we're starting to hit some capacity, as well as, again, continuing to expand our outpatient base that we'll talk about a little bit later with Milford Regional Physician Group and their expansion plans. Our medical staff has been a really integral part of all of the success here at Milford Regional and expansion plans, and we're grateful to them. A couple of years ago, we were very fortunate to hire our Peter Smulowitz as the physician for our chief medical officer, who serves administration, but is also the key liaison to our medical staff. And Peter and the medical staff have been the key individuals that we've looked to in terms of advice on COVID-19. And I'm going to turn to Peter just for a minute to give us an update and his insight in terms of where we're going with COVID. Peter?
Thank you, Ed. Again, my name is Peter Smulowitz, Chief Medical Officer. Nice to virtually meet many of you, and thank you for the opportunity to present today. I will just reiterate something of what Ed said, which is January of 2022, and really January through February, is probably one of the most challenging, if not the most challenging time ever for many of the clinicians who work in this hospital and within the organization. I just cannot imagine a more stressful, trying time for the people who have worked here. And I'm thankful for the great work and dedication they have done every single day through almost an impossible circumstance. And you can see from this, initial graph, just what we have come through is Omicron just kind of blew through incredibly fast, incredibly heavy in terms of the amount of cases and the amount of people that were infected. And unfortunately also resulted in a significant number of hospitalizations and ICU admissions for people that really, unfortunately, were just, devastated by this disease. Thankfully, though, January and February were incredibly challenging, but thankfully we are starting to see and have seen for the last couple of weeks some easing of this most recent of the surges. And that is, I think, something for us to be grateful for, thankful for, but also, just need to keep this in perspective with what the rest of 2022 can look like. Next slide, please. And I just want to be mindful of the fact that also, and you'll sort of see me touch upon this a couple of times during this brief presentation, which is things are much better now than they have been over the past couple of months, but we are by no means out of the woods of this yet. This virus remains unpredictable and has not gone away. We can see that within this data, where we're continuing to see across the United States hospitalizations resulting every day from this virus, especially for the sort of vulnerable populations. And in this case, you can see that darker blue bar is an older population of 70 plus. We're continuing to see hospitalizations, even though, again, the overall sheer number of cases related to Omicron infections has dropped substantially. Next slide, please. And I want to just sort of take this moment then to just remind everybody of the path through this, the remainder of this pandemic is, very much focused on continuing to reinforce the importance of the safety of and the effectiveness of vaccines. Although the vaccines, especially with Omicron, have not been able to prevent every infection, they are still very effective, and we have to continue to remind us of the importance of that and help those who have not been vaccinated to do so. We can see from this graph that being unvaccinated has a 14 times greater risk of death compared to those that have received their vaccine but not booster, and a 90 times greater risk of death for those that have been fully boosted or fully vaccinated and boosted. And if you compare those who are vaccinated without a booster to those vaccinated with a booster, it's a 7 times more likely to die if you've been vaccinated but not received your booster, which sort of just summarizes on the next slide that the booster itself is just better. It really is the key at this point in time. And again, we don't know for sure whether we're going to need another booster. It is likely, although I obviously don't have inside information into this, that we'll see maybe an annual update of this. And I know that the companies working on the vaccines are working on ensuring that the boosters last longer than 6 or 8 months or so, and leading at least to something that we can have for a 12-month cycle. But again, that sort of remains unpredictable. But what we do know for sure is that boosters are better. Very easily seen on this slide is the improvement in rates of death, hospitalization, and any symptomatic infection for getting a booster versus not getting one. And I think that we just need to continue to make as the key message. Next slide, please. And at the same time, I just, and I said this before, that we are not fully out of the woods of this yet. Even when we achieve optimal rates of vaccination and boosting, there are patients, especially those with immune suppression, with cancer, with those as you get greater age, as well as chronic conditions. As you can see from this graph, is the more chronic conditions, the more risk factor somebody has, even if they're vaccinated, the higher risk of death and ICU admission or respiratory failure from COVID-19. So part of our job as a society, part of our responsibility in public health is protecting those vulnerable populations. And this is something we just need to certainly keep in mind as we move forward into 2022. And on the next slide, you'll see that one of the other vulnerable populations, and if you could just advance one more time, you can see that one of the vulnerable populations for this, unlike earlier in the pandemic, has been kids. While it impacts all age groups, we can especially see it in the age group that hasn't been available for the vaccine yet. Too many children are dying from COVID-19. And that just reinforces that, again, Omicron has come through, the surge is easing, but is still having lasting impacts. We have, at this point in time, 3 children every day that are dying from COVID-19. Now, 3 may not seem like much, but it's still too many. Any child that dies at this point in time from this, which we weren't seeing much of earlier in the pandemic, is something that we need to be absolutely mindful of as a society and our responsibility as a healthcare organization. Next slide, please. So to conclude, hopefully I've painted a picture for you of what 2022 might be like. And as you can see from the bottom, from what Winston Churchill said, is I definitely am an optimist. And frankly, I don't see any other way to be, because having a positive attitude is important. But I want us to do that in a way that is supported by what we're seeing around us. So very simply put, the fact that about 45% of the US population has been infected by Omicron, plus the number of people that have been boosted, really does bode well for our immune protection during the remainder of 2022. Plus the fact that we have and will have even more availability of the antiviral, like the oral antiviral therapeutics, as well as expanding vaccines to additional groups of children, ensuring that more of our population get boosted, and following the science for updating the booster gives us protection, gives us something that we can do to help reduce the likelihood that additional surges will occur during the remainder of the year. But we have to be cautious about that, and we can't be overly Pollyanna-ish about this. We have learned the hard lessons along the way that this virus is unpredictable. We simply do not know whether another variant will emerge that will further escape the immune system. And we have to do whatever we can to continue to protect our susceptible populations, as I mentioned earlier, elderly, those with chronic conditions, our children. For those reasons, we need to continue to be mindful of what the impact is, the unpredictability of this, and last but not least, to reinforce again, ensuring that whoever is not vaccinated or boosted has the opportunity to do so. Thank you very much for the opportunity to present today.
Hi, good afternoon. It's Judy Kelly. I'm the Chief Nursing Officer. I'm really pleased to be here and meet you all virtually and share some things about nursing here at Milford Regional. Again, very excited to be here. And I think for me right now, as I reflect back on, we've been through such a challenging, unprecedented time, recruitment and retention really remains a top priority and focus as we rebuild and strengthen our workforce. I'm very proud of our nursing team here at Milford Regional and the care they provide to our patients. And I see my job as supporting our nurses as we recover from this very, very tough time. And I'll speak a little more about recruitment and retention during the Q&A time, but I wanted to mention one important program that we're implementing that will support our nurses. It's our current vendor, TriMedics, for our clinical engineering equipment department. They offer a program on managing mobile equipment. And during the pandemic, it really came to light, especially when we were at capacity and nurses needed to have equipment right available and ready to use and at the bedside, that nurses were spending a lot of time looking for equipment. You know, one good example is IV pumps. You know, we know we have many IV pumps, but they would spend time searching and looking as we moved patients and we were at capacity. And this program will have the support and the people to manage the equipment so that nurses won't have to spend that time. It'll give time back to be at the bedside where we want them with their patients. So this, I just wanted to mention it as one really important program that we're looking forward to roll out for our nurses, and that will happen in April. Our nurses, as many of you know, are now represented by the M&A. And again, we're going through that process, and we understand that first-time contracts take a lot of time. But I did want to share that really both sides are very committed. We're working together, we're meeting frequently, and our goal is to get that contract in place as soon as possible. So I will now hand it back to Ed Kelly, our CEO and President.
Thank you, Judy. Normally, our intent was to have Dr. Pat McSweeney give this presentation on Milford Regional Physician Group. Pat is the president of the organization, and unfortunately, he had something that came up at the last minute, so he sends his regrets. You know, Dr. McSweeney really insists that we refer to him as Pat, so that's how I'm going to refer to him in this talk. I wanted to thank him. He's spent over 20 years in our system, first as a family practitioner, and then the last couple of years being the president of the group, as I've mentioned. And in his tenure as president, he's really focused on recruitment. And boy, has he been successful. You know, we do get physicians that I've mentioned previously that come from our academic medical center. But really, the key, the most significant key to bringing physicians to Milford Regional was the establishment of Milford Regional Physician Group, and particularly Pat's success in terms of that recruitment. I also want to recognize Pat for his leadership. He's done a terrific job advising administration, but also helping to lead the physician group through a very challenging time of COVID-19. I think our success is going to be largely, as a system, is going to be largely dependent on the success of the expansion of Milford Regional Physician Group. And I think to talk about the future plans there, I think it actually is helpful to just look back briefly to see where Milford Regional Physician Group has come, because I think that really sets where we're going in the future. And again, back to when I first came 29 years ago, Milford Regional Physician Group was just setting up its first practice at McGrath Medical with 4 physicians. So just 4 physicians not that long ago. And today it has 130 physicians and 80 advanced practitioners, which I just think is incredible. And often when we're asked why is a community hospital in Milford so successful where others have been so challenged, I think that is really one of the primary reasons of bringing physicians to Milford. You know, I'm just going to take a minute to reflect on all of the different types of physicians that we have in the group, because I think it's incredible. So at the primary care level, which is just so important, we have internal medicine, family practitioners, pediatrics, the combined med peds or medicine peds, adolescent medicine. In addition to that, we're so fortunate to have 4 urgent care centers, and certainly during the time of COVID-19, I don't know how we would have survived without them. And then we have numerous specialties, which I'm sure I'll leave somebody out, that include pulmonary critical care, cardiology, ENT, urology, rheumatology, OBGYN, breast surgery, infectious disease, and urogynecology. And then the two most recent adds to the group that I wanted to highlight were neurology and orthopedics. Neurology has opened at the hospital with 4 physicians, just an incredible kind of startup there. And then orthopedics has joined the group, starting in Franklin, and their new site has just opened in Milford on Route 140. You don't wish our community would go in there, because obviously that would mean that they have an issue. But I've been there. It's really a state-of-the-art facility, 15 exam rooms, 2 x-ray rooms there, and then all the tools that they need in orthopedics, from a procedure room to a cast room. So it's really very impressive. I also wanted to highlight another initiative that started with MRPG about 3 years ago, which is their new facility in Franklin, our largest facility that was 44,000 square feet, which again was really a significant site. And early on, we said, geez, is this too big? Believe it or not, today that facility is completely full with providers. So again, really incredible, both in terms of, again, physician recruitment led by Dr. McSweeney, and again, just servicing the patients and patient demand. And believe it or not, in Franklin, we're actually going back to one of our older sites at 440 East Central Street in Franklin, and starting to add there, again, to meet demand in the community. And then we've also started to roll out the news in Medway on Route 109 of a facility there that will be 22,000 square feet. The planning for that building is going really well, on track, and you'll continue to hear more about that and orthopedics as we start to market those facilities. So I think we'll leave it at that. And Laura, turn back to you in terms of moving to the questions and answers.
Thank you, Ed. We will now come to the questions that have been submitted so far. And again, if you have questions, please submit them in the Q&A and we'll try to get to them. The first question was, my question would be this: I realize mask wearing has always played a certain role in healthcare delivery, and I certainly know its purpose over these last 2 years with protection from COVID. That said, is there a sense of when we can return to non-mask use in everyday office visits, outpatient settings, and simple patient interactions? Understanding their use when clinical judgment warranted it, of course, but allowing for a return to face-to-face interactions in the environments that allowed it prior to the pandemic. Thank you. Ed, can you respond?
Sure. It's a question we actually get quite a bit. When are we going to return? And from our standpoint, we recognize that both from a patient standpoint and a provider standpoint, seeing someone's face is just so important, but it's really driven by a regulatory environment right now. So the honest answer is we have no idea, but we recognize the importance of trying to see individuals, but we continue to monitor that. We do expect that wearing masks is going to be in place for some time, but obviously as soon as we can change that, that's something that we'll evaluate.
Great, thank you, Ed. The second question: in January, I heard from a number of people on their hesitation to go to the emergency room, even though they were ill, because of the increased risk of contracting COVID. How will you reassure us that the risks have been addressed and we should come if warranted? Peter, I think can you respond?
I'd be happy to, Laura. I guess the simplest thing that I would start by saying is I want to reassure everybody that the hospital and every part of our organization where people seek care is incredibly safe. All of the policies, procedures, protocols, the steps that we have taken throughout the last 2 years have been there really to optimize patient safety. And there is obviously a much greater risk to people just in the community of the transmission of COVID-19 compared to the remarkably slim chance of having transmission of disease within the healthcare organization. So perhaps I should just reiterate that it has been incredibly safe. And hopefully just by reassurance and reiteration of just incredibly how safe it has been can reassure people that they should not be at all hesitating to seek care over any concerns of transmission of COVID-19.
Great, thank you. The next question, over the past year, I experienced and I have been hearing about very long wait times in the emergency room. Has the hospital considered implementing an online check-in and pre-screening process? This would allow a patient to know how long before they would be seen, keeping them at home instead of waiting in the waiting area of the emergency room. It could allow referrals to a doctor's office or clinic versus the emergency room. I understand that not all would use this, and in some cases, the emergency is a critical condition like a heart attack, that they should be immediately going to the emergency room. Ed, can you start this off?
Sure, Laura. Thank you. And I'm going to start it and then turn to Dr. Sirocco for some advice as well. You know, this issue comes up from time to time, and I've actually consulted with Dr. Jeff Hopkins, who's the chair of the emergency department. You know, I think we don't do that for two reasons. One is we just don't feel that we could effectively meet expectations in terms of good information. You know, ambulances arrive constantly. I was standing down in the emergency department with Dr. Hopkins one day, and 4 of them arrived at once. So it's very hard to do. We also have different types of patients that come into the emergency room. Later, you'll hear about a new vertical treatment area where we try to get quicker cases through. So depending on why you're there may affect the order of when you're seen. So it's really, really challenging to do. Sometimes we're able to start care very quickly, actually in a hallway bed before we convert a patient to a room. So I think just with the constant arrival of patients, a reason not to do it is that it's challenging. But I think probably as important is the emergency room is just that. It's for emergency care, not sort of like timely, when it's the shortest time. And I think, it really made me think about, we've been in this COVID period where we've been getting different messages about where do we get care, and it has changed depending on the circumstances. And hopefully, as we're transitioning out of a COVID period, we need to go back to where we were before. And I thought it's a good time to sort of call on an expert, Dr. Sirocco, in terms of her insight about if patients are sick, when do you go to a physician's office? When do you go to urgent care? When do you go to the emergency department? Dr. Sirocco is the medical director for Milford Regional Physician Group. She's a key advisor to our system. She's been here for 25 years, believe it or not. And she's a primary care physician by training. So Dr. Sirocco, could you help us just in terms of kind of reorient us in terms of how and where to access care?
Sure, Ed. Thanks for that introduction, and I appreciate the opportunity to meet and speak with you all today. I think it goes back to the mantra of your primary care doctor knows you best. And sometimes when we're ill, the best place to turn first is to us. I can direct my patients best, knowing them over a long period of time and where the level of care that they might need. So in some cases, I will ask them to come to my office. In some cases, I will direct them to an urgent care center for, say, a laceration or, concern for a fracture that I can't squeeze into my busy booked practice during the day. After hours, I still say that the best place to start is your primary care doctor. We're always on call. There's always a doctor to answer questions. And because we have the electronic medical record technology, even if I'm covering for a doctor that does not practice in my office, I can see the chart. I can see who you are and what your medical problems are. So certainly if you feel what you're having is an emergency and you can't wait to call and get an answer from your provider, then you should go to the emergency room, as Ed said. But I think that if you can have the opportunity to speak to your providers in your office, that's a great place to start. We can help see you, we can help direct you, and we know you well. We are so happy to have our offices open and seeing patients, and we look forward to seeing you all in person again.
Great, thank you, Dr. Sirocco. That was very helpful. The next question, can someone discuss the financial impact that the last few years have had on Milford Regional's operating budget and what steps we could or are taking to mitigate the impact to allow the medical center to continue to serve our area and improve our financial position without adding stress to our community? Ed?
Sure, Laura, thanks. It's a great question. And I think, first of all, to kind of summarize the facts, which I've done in a number of forums, but when we look at the COVID period here in our FY20, our overall loss from operations was $5 million. So a pretty big number for us based on our history. It's made up of two components. We would have lost 21 million if we had not received 16 million in CARES Act relief. So we're grateful for the CARES Act relief. It did not make up the entire amount, but a $5 million loss. Going into FY21, we weren't sure if we were done with COVID or not, and our performance improved. So we would have lost 15 million, but we did receive $3 million in CARES Act relief, actually for FY20 activity, resulting in a $12 million loss. So, really for us, a staggering loss to have 17 million over a couple of years. Recently, you may have seen that we're going to be receiving some FEMA money. We actually haven't received it yet. There's been a lot of publicity, and we know it's coming, but that'll be $1.6 million in relief. And we've also, what's been in the press is we've had the opportunity to file for the state for money they've received from the federal government called ARPA money. Again, there was formulas to fill out for that relief. So we filed for 19 million in relief. And we've just been informed that not only us, but the entire state is only going to receive a fraction, a very small fraction of what we filed for. So, and then in terms of the current fiscal year that we're in through 22 through January, because of January, we know we're going to have, an unfavorable year this year just because of what happened, with the third surge. So, if you just look at the numbers by themselves, they're scary. It's not, as I've said at the beginning of the surge, it's not going to put us out of business, but in terms of our future plans, it's challenging. The hope that I have is that most other hospital systems that I talk to have the exact same dilemma. We don't have the solution, but we are still hopeful that between different sources at the state and the federal government, that there's still some relief coming. So otherwise, it's going to be staggering just for not only for us, but for our entire industry. But in terms of our plans, we're still kind of dealing with COVID, not COVID patients coming into the hospital, but really the pent-up demand that we've seen from COVID. So in terms of the surgery or physician visits that have been delayed with follow-up ancillary. So I've been a big believer. I've always really said it here. Our mission here is to take great care of patients, take care of our community, and I'm a believer that the rest will take care of itself. And so that continues to be the path that we're on. Our focus is take care of patients. We do recognize that we do have some, facility, capacity issues, and that's why we're working on these other plans. So we basically are working short-term and longer term, and working with all of the regulatory agencies that we can. So we are hopeful, and we can't give absolute assurance in terms of what's coming, but I'm an optimist here, and so we'll keep you posted.
Great, thank you, Ed. The next question is, what is the Milford Regional Medical Center doing to reduce the stress and COVID risks to staff, which ultimately can affect patient care? Ed?
So I'm going to start with that and then hand off to Peter and Judy. I think what we hear mostly from our staff in terms of their stress level, it's no surprise, is it's staffing to help support them. That there just seems to be shortages throughout our system, and we'll talk a little bit later. We've talked a lot about physician staffing, but really staffing everywhere in our system is an issue, and so that is really a priority. But there's not just one thing that we're doing to take care of our staff, and I'm just actually going to ask Peter and Judy to talk in their areas about an item or two that that help to support our staff?
I'll start and hand it off. So again, like Ed said, we understand the incredible strain for our work that our workforce has been under. So I just wanted to kind of highlight 2 actions that I think will help reduce stress and that are priorities for us. So one is, I mentioned a little bit about recruitment. I think the commitment to focus on recruitment and retention so that we strengthen our workforce, which will lessen the burden for those that are here and on the front lines. So that's really a priority. And we're looking to recruit, obviously, not only experienced nurses, but new nurses. And we did start a new program last summer. We hired 21 newly licensed nurses, and we had a new program to help support them. As you can imagine, this is a stressful time to enter healthcare. So we had a program that included clinical and didactic, but it provided additional support. Those nurses that were hired in late August are now kind of finishing up this support that we've offered them, and they've done very well. And we plan to continue and offer that program again this year. And in addition, we'll continue to work with our schools of nursing. We have them for clinical rotation, and we also use them for recruitment. This is the time of year when we hire student nurses. They've always been an important source for our future nurses at Milford. We get to know them, they get to know us. So we are in the process of hiring students as well. And of course, our recruitment and retention always involves partnering with human resources and looking at new ideas, different ways to recruit, and a focus on not only on nursing, but on all the assistive personnel that support nursing. So that's all in process. And then the other thing, the second item I wanted to just mention was that we're really focused on the wellness of our staff, knowing all that everybody has been through. We've seen the stress that COVID has had at work on our staff. And of course, that's carried over to home. I mean, we all know that it's been everywhere. So Human Resources has offered a number of wellable challenges and an app that you can get that's available to people online for all employees. And all of these things really encourage physical activity, good nutrition, positive mental health. So those are all in process. And then I wanted to mention 2 specific kind of grassroots efforts from our frontline staff. These were nurse-led initiatives, and they really were such feel-good activities. The nurses implemented really creative ways to kind of reignite some enthusiasm and positivity on their units. And I think it demonstrates their resiliency. They really have stepped up to the plate. So 2 that I would mention on Gannett, which is our cardiac unit. They have spirit weeks with different themes, like it's a cardiac unit. They may all wear cardiac themed shirts one week, but they do things to kind of celebrate, bring some joy to the work. And it's really had an effect on their team. And on MP1 as well, they've had kind of a Spark the Joy raffle, and it was generated for fun. And they have 3 times a week, they would pick one of the employees, and they would get to pick from a number of items that were donated. And it was really brought forward by the frontline staff, and the managers have supported them. When you go to MP1, if you look in the manager's office, I wasn't sure what she had going in there, a little bizarre, but she has all kinds of gifts. And then so they've worked together to make this happen, but it's really kind of boosted morale and been such a nice thing to do to kind of reset people, get on a positive, just energy going. So again, those are just a few things that they've done that I think are, again, we're really pleased and hope to continue that. And then I would hand off to Peter I know he'll share some other good efforts that have happened.
Thanks, Judy. And again, just to sort of reiterate, the reality is that everything I think that I try to do, everything that our team does is intended to support our staff. And there really isn't any single step that's going to sufficiently address what have been just incredibly, these immense strains that our staff have experienced for the last 2 years. But every action that we focus on is meant to bolster their resilience and welfare. And for me, part of that is just listening to the physicians, listening to the clinicians in the hospital, understanding how they're feeling, understanding their frustrations, and working every day to sort of make their job easier. There are many ways that I think we try to do this, but just very briefly, one that I'd like to share that has really had a positive impact is that we recently had 2 open forums for our staff where they shared their experiences, their feelings, and their perspectives on life and healthcare during this pandemic. The first one was attended by approximately 100 medical staff, and the second by over 50 medical staff and nurse leaders along with respiratory therapy. And from the feedback that we've got, these sessions were an incredible opportunity for people to share their experiences, to promote a common sense of purpose and community, and really to remind people of the joy in their jobs. Bringing people together and sharing the experiences was just a real highlight, and just one of many opportunities, I think, for us to continue to support our staff through what has been an incredibly difficult time. Thank you.
Great. Thank you, Peter and Judy and Ed. The next question is, testing and the rapid turnaround of results is key to reducing COVID spread. What is the hospital doing to ramp up the needed resources and keep the turnaround of test results under 24 hours? Ed, can you start us?
Sure, Laura. I just wanted to introduce Nicole Fine, who's our Executive Vice President and Chief Operating Officer. Nicole has been at the hospital for 15 years. Her span of areas that she manages include clinical, administration, and IT support, and she's been instrumental in terms of COVID activity in our command center. So I'm going to hand this off to Nicole in terms of responding.
Thanks, Ed, and good afternoon, everyone. Milford Regional is committed to providing timely diagnostic testing for our patients in the community, and this held true for COVID-19 testing. We actually have multiple platforms that can perform COVID-19 testing for our patients, all of which provide a quick turnaround time, most often under 24 hours. At times during the pandemic, when the volume of COVID testing exceeded our capacity, unfortunately, turnaround time was affected. And also we were challenged with allotment restriction from our vendors, and this prevented us from having open access to community testing without a physician order. But just recently during this past surge, we were successful in securing additional supply, and we opened a drive-through specimen collection site in order to alleviate the congestion in the emergency department and in our urgent care clinics where a lot of patients were just seeking testing. But most recently, the demand has declined for this service, so we've decided to close the drive-through. But certainly in the future, we can reestablish the service if there's a need. So today, if you have a need for COVID-19 testing, we encourage you to contact your MRPG PCP to arrange for testing, or visit one of our urgent care clinics. We have 4 of them to be seen by a provider. The urgent care clinics can provide symptomatic, asymptomatic testing, as well as testing for travel purposes. We also don't want to forget that we encourage the use of home tests, which fortunately have become much more available. There are opportunities to secure free tests, home tests through the federal government. In addition, insurances cover the cost of those home testing as well.
Thank you. Okay, the next question is, the past 2 years have been challenging. It has also presented opportunities for us to learn and improve our services. Can you describe 3 examples of how Milford Regional Medical Center's services have greatly improved from the COVID lessons of the past 2 years? Ed, can you start us off?
Sure, Laura. And that's a great question, and I'm not sure everyone would pick the same 3 items. So I have surveyed a few individuals, and I think the 3 that we'd like to speak about today, and I'm going to call on experts in each of those areas, but the vertical treatment in the emergency department, we're going to have Dr. Smulowitz speak about. The second area is supply management, which I'll have Nicole Fine speak about. And then telehealth, which many of you may have ended up using. We'll go back to Dr. Sirocco to give an update. So Peter?
So I'll speak briefly just about the vertical treatment area, which really highlights the ingenuity of our emergency department team. as folks will obviously recall, the last couple of months had an incredible surge of demand for services within the emergency department, both related to pent-up demand from people delaying care over many months and from the overwhelming need for care related to COVID-19. And quite frankly, the demand got so high that it really outstripped the ability of the emergency department to see all patients in a timely fashion. And we would end up having times where we had numerous patients waiting in the waiting room, and unfortunately, too many patients left without being seen. So to respond to this, it's not like we could all of a sudden build a second emergency department, but sometimes space isn't the answer. And so what the team did was orchestrated a way within one of the back hallways of the emergency department to put chairs to be able to see what we call patients in a vertical area, meaning those that are lower acuity that oftentimes would wait behind patients of higher acuity would be brought into this area where there are chairs set up, expedited their care, brought through much more quickly, attended to by a physician nursing team, and were able to really help to see patients that otherwise would have had to wait for far too long. And I think we've estimated that on average, we're seeing 20 to 30 patients per day in that space, which has been a huge benefit to the patients waiting to be seen. And again, hats off to the ED team for doing so.
Okay, I'm going to talk a little bit about our lessons learned about supply chain management. Prior to the pandemic, the practice of minimizing inventories, as well as the worldwide impact of COVID-19, caught really all organizations, even us included, as well as suppliers, by surprise. For most of the pandemic, we were allowed only our normal pre-COVID allotment of PPE, as well as other supplies. To get a little bit of an understanding of usage of PPE, I'll talk just specifically about gowns. Pre-pandemic, we used 10,000 gowns a month. And at the height of the surges, we actually used 2,500 gowns a day. During the pandemic, we worked diligently to source supplies from other avenues, as well as relied on the state stockpiles to secure items that we needed. As a result of these lessons learned, we have continued to diversify our suppliers and really build a more robust inventory to support our future needs moving forward.
So I think one of the bright spots of COVID and technology in general has been the promotion and use and expansion of telehealth. I was joking with Ed yesterday when I said, yeah, we've expanded. We went from never using it to using it, during COVID for the first time. I think this excellent technology has allowed us to maintain good patient care with our patients. It's also allowed us to see patients who may not be able to get to our office for a variety of reasons. A mom with 3 little kids, and during COVID, we certainly said, don't bring anyone extra to the office. Well, if the mom needed care and she couldn't have a babysitter, we could still do a telehealth visit and give her really good care over the phone. Chronic disease management has lent itself really well to some telehealth visits. We want to see our patients in person, but there are times when it makes sense to see folks over a telemedicine evaluation. And I think that the technology and the ability to pivot on a dime, there are days when I'll see 5 patients and then I will have a telehealth visit in the mix for whatever reason that is. And the fact that we can still continue to do that and use that tool today and going forward, I think is definitely a positive opportunity in the COVID-19 pandemic.
Great, thank you, Dr. Sirocco. The next question, what is the impact of the nurses unionizing? Will the community see a change in the patient experience? Ed?
I just wanted to start by thanking all of our nurses that we have here today. I mean, for me, it's been business as usual in terms of direct patient care, and I continue to hear incredible things from our patients about our nurses. But I want to defer to Judy in terms of a little bit more detail about what a unionizing issue is in terms of what it means versus. So Judy.
Yep, thanks, Ed. Again, I would say that I do not expect to see any change for our patients. We expect to provide the same excellent patient care. The unionization is really about how we work with employees internally, So I don't really see any change. I think, we still have our same fabulous nurses, and our goal is to provide exceptional patient care.
Thank you. The next question is, with the mandate lifting, does the hospital have plans to hire back some of the nurses and doctors that were let go to help with the worker shortage? Would the hospital ever consider hiring back nurses and doctors that were let go if they agree to test for COVID or antibodies? Ed?
So in terms of our efforts to keep our patients, our staff, and our community safe, we're following standard healthcare practices that include what we did before with the booster, and a new initiative that we started this week, which is to announce a mandate for the booster shot. So that's the path that we see ourselves staying on. Anyone that's in compliance with that can apply for a position here, but we don't see changing our positions or having an alternative to that kind of standard practice.
Great, thank you. The next question submitted was, what comes to mind for topics focused on the influx of immigrants or undocumented residents and the impact on healthcare, education, and living conditions? What impact has this had on the hospital as far as healthcare costs and volume, especially for providing care for uninsured patients? And have these challenges been exacerbated by the pandemic? Peter?
Thanks, Laura. I'm going to start with this topic very briefly, and then I'm going to turn things over to Ed as well. The sad reality is that unfortunately, this pandemic has only amplified what have been some of the pre-existing disparities in health equity in our society, including and notably for immigrants and people of color. And where we have certainly seen this disparity play out is the trust in and access to the vaccine. And as we've talked about, noting that the vaccine has been such an incredibly important part of this, those issues related to vaccine access and trust for these vulnerable populations has meant that these populations have also been severely impacted by the disease and death related to COVID-19. And as a healthcare organization and as our sort of moral and ethical duty to address these ongoing inequities is really one of my, sort of principal focuses. So thank you.
I would just add a theme here is access to care. And, we take care of everybody regardless of their payer or insurance status. But I think in terms of this update, we wouldn't be doing our job if we didn't have a plea to our community to get vaccinated. As I walk around the hospital, I talk to physicians and particularly to nurses. What's really plugged up our system and the healthcare system in this state and nation largely, unfortunately, comes down to unvaccinated individuals. And that's particularly true in the ICU, where these stays have been incredibly long, intubated patients that have not fared well. So again, there's a lot of education out there. And from a medical standpoint, all of the advice that we're getting is please get vaccinated. So thank you for the opportunity to say that.
Great, thank you, Peter and Ed. We do have one more question. I'm going to go quickly, and hopefully the response can be quick so we can answer all the questions submitted. Could you explain what regulatory agencies, DPH, CDC question, and their related regulations or guidance that have impacted the decisions made by Milford Regional Medical Center regarding COVID-19? Ed, do you want to quickly?
Right, sure. I'll shorten my introduction of Bert Thurlow-Wall. He's joined us 3 years ago. He's the Vice President and Chief Quality Officer. He's been instrumental in terms of improving our game here in terms of quality. He's led us to get the 5-star rating with CMS and the continuous awards with Leapfrog. So Bert is our regulatory individual, and I'll turn it over to Bert for a short answer.
Thank you, Ed. Good afternoon, everyone. To answer this, I'll be real quick. Healthcare organizations have multiple regulatory agencies at the federal and state levels that provide guidance, rules, regulations, and oversight. During the pandemic, the Milford Regional System received continuous guidance from the CDC to the Joint Commission, from the Food and Drug Administration to the Massachusetts Department of Public Health. However, the majority of our guidance was provided to the Massachusetts hospitals through the Massachusetts Department of Public Health. Here at Milford, the system's senior leadership, we reviewed all guidance and mandates with our internal infection control leaders, as well as other key stakeholders such as the medical staff, nursing, facilities, radiology, and other team members. The guidance and regulations were constantly changing. Even early on, it was almost daily, which required rapid review, discussion, implementation, and communication of new policies and procedures that needed to go out to staff, patients, and the community. Some guidance and regulation examples you may be familiar with are the visitor policy changes, reduction of surgical procedures, our use of masking gowns, and the management of vaccines. Thank you. I turn it back over to Laura.
Great, thanks, Bert, and thanks for the brevity. That was very helpful. I believe that's all the time we have for today's conversation. As I mentioned, if there are any other questions that you have, please contact us. We'd be happy to answer them. And to provide our final conclusion, I'd like to turn things over to Board of Trustees Vice Chair Anthony Consigli. Anthony, as many know, is the CEO of Consigli Construction and is an active and valuable community and board member. Anthony?
Thanks, Laura. So just in wrapping things up today, we just want to say thank you to all the residents, community and business partners for participating in today's discussion. We do hope to do more of these forums in the future so that we can better connect with our community and better engage with the people that we serve. Second, we do appreciate the confidence that you have in Milford Regional and its commitment to providing exceptional healthcare service with dignity, compassion, and respect. Lastly, please help us in sharing the discussion that we had today with your friends and family, and help us spread the word on future community conversations, as soon as they are announced. In the meantime, as Laura said, please continue to send us feedback, send us questions, foundation@milreg.org. So thanks all.